Hello and welcome to Cloud-Enabled Transformation, Google Cloud's impact on healthcare and retail. Today we bring together industry leaders on a single platform to explore how healthcare and retail sectors are transforming and thriving in the digital age, powered by the innovation and capabilities of Google Cloud. A roundtable session was held where leaders from the healthcare and retail sector discussed how cloud, AI, and data-driven innovations are transforming the healthcare and retail sectors, empowering organizations to deliver smarter, faster, and more personalized experiences with Google Cloud.
Health comes as our DNA. Google has been a health and a public-focused company for a very long time, over 2 decades. Google Health predates Google Cloud, where we have been building medical-grade models. We have been contributing to medical research in the last 2 decades alongside our search business. And this also helps us kind of create an edge when we bring our cloud offerings, when we bring our AI offerings to the market. So if you see a number of our products, and I'm going to breeze through some of these slides, but a number of our products have been kind of evolved into serving the specific needs of this segment. A lot of the recent stress has been on multimodal. While GenAI started its journey a few years back, it's important to see that both Google and the ecosystem has been evolving towards multimodal, and that's the real differentiator when it comes to these models, right? Unless you are able to upload an image of a scan or a pathology sample, or you are able to upload a doctor's prescription, or you're able to upload radiologist reduction. So while the GenAI started as a text-to-text kind of interaction, having multimodal capabilities, and this is where I think Google MedLM or MedPalm or MedGemini has now come out with multimodal capabilities, which makes us a lot more relevant to our customers. If you want to do a genomic variant calling or a mammography calling, or the examples that I've been talking about earlier, a lot of them are image-specific needs, right, or use cases. Having the multimodal capabilities helps you go a little deeper into these use cases, be able to derive more value from the model rather than having a just text-to-text interface. So I think the advancement in multimodal in the recent year has been a meaningful boom in terms of the variety of use cases you can try with these models. So that's an insistence on this particular slide. While a lot of you know about MedLM, MedGemini, what we have in the market, having multimodal capabilities there gives you a lot more power to apply it in various use cases.
So this is a sample lab report from ThyroCare of a patient named Ajay. So what we are doing is to do a summarization of this lab report, which could be used by your lab technicians. So typically, all these lab reports come with the proper monitoring, as in the vitals that they have calculated, along with the final summary of the report, wherein they summarizes the whole report, and then they give us a caution of consult a clinician after this, right? So that is something which can be easily automated with the help of LLMs and with the whole multimodalities in terms of the input.
Thanks Ravi and Nishu for these great examples. Another example which is very near and dear to me is also the DeepMind work that Google has done. I was hoping that Ravi doesn't touch that, But from my childhood itself, I have been very passionate. Though I have not gone into the area of research and etc. But while we looked into some of the examples of how GenAI can help in marketing, customer experience, etc. The way the Google DeepMind team came up with this whole GenAI model, which can actually do protein structure analysis, right? And what I can understand is it saved actually 10 years of work, right? Because before that, everything is done manually. Right now, if there is a pandemic tomorrow, similar to COVID, I think these medicines could be discovered using these models. And I have followed the Nobel award, and this is the first time I have seen that the Nobel award for chemistry being given to 2 Google scientists who are computer scientists. They does not have, so shows the power, right? It's not just limited to customer experience or BFSI or retail, but it can fundamentally change.
Up next, we have Ravi Banka, Global Account Manager at Google Cloud, sharing his valuable insights in a thought-provoking conversation on the full spectrum of digital transformation and cloud innovation.
We're now in conversation with Ravi Banka, who's the Global Account Manager at Google Cloud. So thank you so much for taking the time to speak with us.
Thank you, Pooja.
All right. So for sake of some context setting, all right, when we talk about Google Cloud, without there being a bias to the conversation, what do you consider to be some of the perhaps product differentiating features, given it's an incredibly crowded space, cluttered with competition?
I feel there's quite a few differentiators that make us stand out, and we have seen this kind of reflecting in our success in the Indian market as well. Especially if I start with healthcare particularly, right? Healthcare is in the DNA of Google, right? I mean, we have Google Health as a separate entity at Google, which itself is like the core of our understanding of health as an ecosystem,
Sure.
supporting public health, supporting the global state organizations, the Indian public sector organizations, etc., to kind of make sure we are improving the outcome of healthcare institutions and everybody associated with providing healthcare services.
Well, Ravi, walk us through some of the success stories, perhaps within the context of the healthcare sector more specifically, that you're most proud of at Google Cloud.
So a number of customers that we engaged in the last year where we have helped them scale and build models which are scalable. If a doctor ratio is very poor in an organization, how do you kind of make sure that doctor is able to multiply and serve more customers? He's able to do an accurate understanding of a patient's condition, right? Having technology, having the data, underlying data accessible, having a model kind of able to summarize these things for a particular organization or a doctor or a patient or a nurse, right, helps improve the outcome and also accelerate the overall journey.
Absolutely. And Ravi, if I could build on that, AI or generative AI more specifically has truly become a buzzword, irrespective of sector, irrespective of the age and stage of the company. But tell us more about how you expect these technologies to influence not just the space, but the Google Cloud Solutions Suite going forward.
I think AI has been our DNA for decades now. I mean, it's not something new to the tech world, right? Even though the buzzword has started recently in the last couple of years after the advent of Gen AI keywords, right? Google was one of the first companies to publish the LLM models even 5-7 years back, right?
Right.
And we have been integrating AI into everything that we do, right? I mean, whether it's analytics, AI, into everything that we have been doing in the last decade or so, right? Even the Google search was powered by AI. The Google Maps has underlying AI layers. Gmail that everybody uses, right? I mean, billions of users use Gmail today is powered by AI technologies. What we're also trying to do is get this to a B2B segment rather than just the consumer-focused products,
Sure.
where we bring in the Gen AI and AI advancements into our products. We talked about MedLM earlier, or MedPalm, what we call it, multimodal capabilities, where the models can be now used by pathologists, it can be used by doctors, it can be used by radiologists to kind of get more insight into what they are doing on a day-to-day basis, what a human eye could possibly miss. How do we use AI technology to make sure we are improving the outcome for our customers, for their patients, for example, right?
Right.
Having this technology is, I think, the biggest boon of today's tech generation. I think we have a very powerful tool at hand. Google is one of the companies which are positioned to have the right platform, the right engineering behind it to bring this to the masses. And I think we are doing a great job at it.
So that said, Ravi, thank you so much for taking the time
Thank
to
you,
speak with
Pooja.
us. And we look forward to discovering what Google Cloud does next.
I'm sure there's always something new coming out of our garage.
Thanks for joining us.
Welcome back to Cloud-Enabled Transformation, Google Cloud's impact on healthcare and retail, wherein industry leaders explored how healthcare and retail sectors can transform and thrive in the digital age with the power of Google Cloud.
In Wayanad in Kerala, there is a Amrutanjan hand wash or a hand sanitizer which has been launched. The marketing team, central marketing team sitting in Mumbai, they understood that the best way to capture that would be to enable capture of these kind of images. And to start with, during COVID, they started off as simple as sharing those images on WhatsApp and putting it on one store, and then running it through ML to see who all are the new competitors, what is trending, what are the creative ways in which people are selling in the same category as they are, and how they could adopt as brands.
So you basically need to have a process where your local sales teams, the ops teams, upload images and these come from, say, 100 different locations, and then this gets filtered down, and then you will have through AI, you summarize a report or something where, say, somebody like me sitting in the head office can make sense of it. And I always don't have the bandwidth to go through 100 reports.
You don't, and it's hard to understand which all are the outlier trends. I might be a very active distributor or salesperson, and I might be shouting at the top of the voice saying that Amrutanjan's sanitizer is a threat to our business. But in the overall scheme of things, it might still be smaller. That view can be derived only when I put this as an action or a task on the beat plan and start picking it up at scale from everywhere. So I've captured not only the image, where location it was captured, the time of day, etc. So now I can really have a geographical system which is available as an MIS to me, to see what are the trends emerging in my marketplace for my own product as well as for the competitors.
Next, we had a conversation with Preetham Dey, Key Accounts Executive, CPG, Retail and Healthcare, Google Cloud. Let's have a look.
We're now in conversation with Preetham Dey, Healthcare Go-to-Market Specialist with Google Cloud. Preetham, thanks so much for taking the time to speak with us. All right. So now when we talk technology and when we talk healthcare, right, the two are intersecting and intertwining at breakneck pace. Tell us more about the role that technology is specifically playing in driving the evolution of the healthcare space.
The amount of data which is available today, which is coming in from wearables, from lab tests, from doctor reports, the prescription information is now getting digitized and is now available for consumption. Not just are they a wealth of data is available, there is AI which can help process all of this data and bring truly personalized healthcare and make it accessible at scale.
Cloud tech is an incredibly crowded space. It's cluttered with competition. What sets the Google Cloud solution suite apart?
Google Health preceded Google Cloud. So even before there was anything called as cloud, we always had Google Health, because where else do people turn up for health related queries but Google, right? And we knew that we were interacting with consumers and communities at scale, and we had the potential to make impact at a huge level, which is where we have already been doing a lot around helping consumers get to the right health information, not just on search, but also the second largest search engine. Guess what? YouTube.
Right.
So even on YouTube, we have empaneled doctor videos wherein we are giving them the right healthcare suggestions. With Fitbit, we are bringing in wearable technology to the users, and a lot more, many interactions with in the day-to-day life of the users. Now comes the enterprise part, which is where Google Cloud comes in, and our journey on healthcare has been throughout development of specialized healthcare large language models as well as data enrichment models, which we have been working on. The history is pretty large over the last 6 to 7 years,
sure.
But now where it is getting culminated in, and that's where the interesting areas lie, is around looking at, let's say, a multimodal use case wherein there is a chest x-ray presented, and the model is able to predict the risk of TB with a fairly accurate accuracy of around 80%.
Right.
And MedLM, which has been the cornerstone of our AI technology roadmap for healthcare, which is helping both clinicians as well as care assistants who are able to provide better healthcare facilities to the patients, scale out, reduce the cost of providing the healthcare delivery, at the same time bring good quality services to their people.
Well, thank you so much, Preetham, for taking the time to speak with us, and we wish you and the Google Cloud team all the continued success.
Thank you for having me here.
Thank you.
We are the intersection between the payer, the provider, and the patient, right? So when we are using technology, when we're using AI, when we're using some of these tools from Google Cloud, etc., it's fundamentally to look at two things. How can I improve experience? How can I improve health outcomes?
We are trying to do with all of the data that we have is to tell the members what is the sort of hospital that they should choose for the particular ailment. Most of the surgeries that we have are planned surgeries. So we would know beforehand that, in 5 days' time, I'm going for this surgery, this ailment in this particular hospital. Now I know the kind of policy that I have. Now, basis that policy, if I were to choose, let's say, a single private room, I am able to predict that what is going to be your out of pocket even before the surgery starts.
For us, we do also have multiple use cases, and if we broadly divide, the way we have divided, one is for the patient convenience or the patient level, one is at clinical level, and then one is operational efficiencies improvement.
Up next, we spoke to Gaurav Mundra, Vice President Product Management, IKS Health. Let's take a look.
Gaurav Mundra now joins us from IKS Health. Sir, thank you so much for taking the time to speak with us.
Thank you so much for having me.
So, sir, when we talk cloud technology, what do you consider to be some of the leading trends? What do you consider to be some of the perhaps leading challenges and opportunities? And where does Google Cloud fit in your view, vis-a-vis what I've just asked?
People, and especially leaders in tech companies, have to move away from thinking of AI just as a tool to reduce cost or bring in efficiency. They have to start thinking of AI as a strategic advantage as to how it can transform their business.
Sure.
And when it comes to making AI a strategic advantage for the organization, that is where cloud comes in. Because cloud really enables you to experiment. Cloud enables you to deploy your workloads faster. And cloud allows you to use some of the existing tools and technologies.
Well, sir, from the point of view of the company in their journey towards essentially adopting, cloud-based technologies, what are some of the key considerations in your view? And how do you look at Google Cloud vis-a-vis that equation?
It's not a decision that you can change at the flip of a switch.
Right.
It's a decision with a very long-term impact on where you land up.
Right.
And especially because we are from healthcare, we are paranoid about data security and data privacy. And that is where I think Google has done a good job. And Google has provided us the ability to go back to our customers with confidence and say that, hey, your data is safe, data is secure, it's private. And we've had agreements with Google, for example, where Google has even agreed not to use data for training their engine.
Right.
I think that's one of the biggest things in getting the ball out of the door. And that's where the conversations start.
Sure.
So I think that's number one. Number two, the cost has to be one of the major considerations, because the scale at which clouds were deployed pre-AI versus post-AI is going to be very different. The keyword these days is token. How many tokens are you using?
Yes.
And what will be the cost of the token? So I think that is where organizations have a lot of focus. CFOs, CIOs, everybody is looking at that very carefully and evaluating their cloud solutions partners, keeping in mind they want something more predictable, something more flexible. I think those two would be the top two in my mind.
All right. Thank you so much for taking the time to speak with us, and we wish you and the larger IKS Health team all the very best for what lies ahead.
Thank you so much.
Thank you.
Up next, we sat down with Chaitanya Bhardwaj, Head of AI, Apollo 24/7. Let's take a look.
We're in conversation with Chaitanya Bhardwaj, the Head of Clinical AI Products at Apollo 24/7. Sir, thank you so much for taking the time to speak with us.
Thank you.
Somewhat of a broad, overarching question here, but walk us through how technology can essentially, in the context of the healthcare ecosystem, improve patient outcomes, work to the benefit of doctors, and future trends going forward.
Right. So what we've noticed when we deal with technology for the benefit of our users and doctors is primarily to do with information. Right? So there is, obviously, when it comes to consumers or patients, there is information asymmetry, right? What they understand versus what the health experts understand.
Right.
So one of the things that we are trying to do is to break that barrier, which means the guiding principle is that expertise is for everyone. Sure. So therefore, expertise is available for consumers as well, right? So with that guiding principle, we've used technology to be able to provide highly personalized health answers to our consumers, right? So a lot of consumers, as you know, go to search engines to get health information, right? However, there is a lot of information that is missing when an answer is provided. We've used technology to essentially create an opportunity where consumers can report their history, and as long as these consumers are part of our organization and they have history available with us, then we factor that in, and then even for simple questions related to health, we're able to use that information in order to personalize the answers to them, and that's very important.
Absolutely. And sir, future trends. You know, I'm not going to ask you to look into a crystal ball, but if you had to, what might you say?
Yeah, so I think future trends is already trending towards a lot of multimodal interactions with AI. And by multimodal, what I mean is users, whether it's doctors or consumers or patients, will be able to interact in natural language, whether it's in English or regional, whatever they're comfortable with. They will be able to interact with voice, and they'll be able to interact with images, documents, and so on and so forth.
Exciting times lie ahead. Thank you so much for taking the time to join us, Chaitanya, and we wish you all the very best.
Thank you, my pleasure.
And finally, we had the pleasure of catching up with Madhur Gopal, AVP Marketing, Sales and Digital Initiatives, Manipal Health Enterprises. Let's take a look.
So Madhur Gopal now joins us from Manipal Health Enterprises. Sir, thank you so much for taking the time to speak with us.
Pleasure.
All right. So when we talk Google Cloud, all right, and when we talk cloud-enabled solutions in particular, what do you consider to be some of the leading trends that have the most potential to influence the industry going forward, perhaps more specifically in the context of healthcare?
So what's happening in healthcare that if you see from a consumer healthcare behavior, that is shifting. Few years back when Fitbit came in, I think the whole way consumer started taking care of their own health changed. Technology started coming into human lives more so, and because of that, when we treat patients, there are a lot of new technologies which are emerging in that space to make sure that there is an improved medical outcome. And there is a better convenience to the patients.
No, that's very helpful, Madhur. And one of the leading concerns, of course, in the context of the healthcare space more specifically, is data privacy when it comes to patients and their medical records, their medical histories, right? To what extent is the cloud an enabler or a cause for concern?
So when we go to cloud per se, that's where I think the security measures comes in more stringent, right? So we as a company are DPDP compliant. We are working towards that, and data privacy is becoming extremely critical. There are some solutions which comes as a data stack, part of Google Cloud. What it does is it actually helps us to regularly monitor. There are like VAPTs and all that stuff, what you do to ensure that there is no data leak which is happening. Now, because this data leak layer is talking to these multiple third-party apps, so you provide a security layer so that what information is going out is a masked information.
Right.
So there is, at any point of time, there is no information shared outside.
Thank you for sharing so many very tangible examples of how cloud is leveraged within the healthcare space on an everyday basis. And we wish you and the larger Manipal Health Enterprises team all the continued success, sir.
Thank you so much for having me here, and we also look forward that to bring in more better solutions to our patient, because we believe that it's still in nascent stage. There are solutions which we have deployed which are waiting to scale up. There are few which have already scaled up. So digital transformation is happening. People are adopting new technologies. So hopefully we should continue to deliver, patient convenience and improved medical outcomes.
Very heartening to hear.
Technology.
We look forward to it.
Thank you.
Thank you
So much.